Hi, my name is Jill. I'm going to be your student nurse today. First, I'm going to take an inventory of all my supplies I have before I begin my head-to-toe assessment. So I have my stethoscope, my pen light, my gloves, my hand sanitizer, and my alcohol wipes. So I'm going to perform infection control before I begin. Okay, so first I'm going to have you memorize 3 words to test your short-term memory. So the 3 words are sun, dog, and tree.
Sun, dog, tree.
Okay, perfect. So I'm going to ask you those later on in the assessment. So first question before we begin, do you have any assistive devices you use?
No.
Okay, and do you have any pain right now?
No.
Okay, and just report any pain you have during the assessment. So first questions I'm going to ask before we begin our initial assessment are, what's your name?
Hannah.
What's your location?
Old Orchard Beach.
And what day is it?
Sunday.
Okay. Patient is alert and oriented times 3. There is no slurring of the speech. She has clear speech and level of consciousness is appropriate, and she answered questions appropriately. All right. First, I'm going to test your cranial nerves. So can I have you smile for me? Can I have you frown? Can I have you raise your eyebrows? Can I have you puff out your cheeks? Okay. Patient cranial nerves are intact. Next, I'm going to test your fine motor skills. Can I have you pick up your hands? Touch each finger to your thumb and back. Perfect. All right. Patient fine motor skills are intact. Next, I'm going to check different sensations of your upper and lower extremities. So can I have you close your eyes? All right. And just repeat or just let me know what areas I touch on your body.
Left foot. Right hand. Right foot. Left arm. Left cheek.
All right, patient sensation of the upper extremities are intact. She was able to appropriately identify each upper and lower extremities. Next, I'm going to have you stand up, and I'm going to set your gait and your balance. So can I have you walk to the end of the room? And then can I have you walk back? All right, patient's gait and balance and coordination were intact. Next, I'm going to have there was no swaying or limping upon ambulation. Next, I'm going to have you stand on one foot and balance for me. Right, thank you. And then stand on the other foot and balance for me. All right. Patient balance and coordination was intact and was able to respond appropriately. All right. Next, I'm going to test range of motion of your upper extremities. Oh no! Next, I'm going to assess your spine. So I'm going to have you turn around for me. And dive forward. Perfect. All right. Upon palpation of spine was straight. There was no masses upon palpation. Posture is erect, and there were no signs of scoliosis, lordosis, or kyphosis, and there was no curvature of the spine present. All right. Next, I'm going to do range of motion of your upper extremities. So can I have you bend your arm around in a circle? Perfect. No crepitus. Do you have any pain?
No.
All right. Next, I'm going to have you bend your elbow. No crepitus. Do you have any pain?
No.
Next, I'm going to have you bend your wrist. No crepitus. Do you have any pain?
No.
Nope. All right. Other side. Turn your arm in a circular motion. No crepitus. Do you have any pain?
No.
All right. Next, I'm going to have you bend your elbow. No crepitus. Do you have any pain?
No.
All right. Next, I'm going to have you bend your wrist. No crepitus. Do you have any pain?
No.
Okay. Now can you, next I'm going to test your strengthening of your upper extremities. Can you hold your hands out like this? All right. I'm going to push up and you resist my. All right. Perfect. Next, I'm going to push down and you resist. All right. Perfect. So patient strength was 5 out of 5. Next, I'm going to do range of motion of your lower extremities. So, can I have you kick out your leg for me? No crepitus. Do you have any pain?
No.
Can I have you bend your knee? No crepitus. Do you have any pain?
No.
And can I have you kick out your leg for me? Okay. No crepitus. Do you have any pain?
No.
And can I have you bend your knee? No crepitus. Do you have any pain?
No.
Okay. Patient skin on the upper extremities is pink, dry, and warm to touch. Patient skin on the lower extremities is pink, dry, and warm to touch. Right, can I have you sit down for me? Thank you. you. Next, I'm going to test your range of motion on your feet, your lower extremities. So can I have you twist your ankles around? No crepitus. Do you have any pain?
No.
Okay. Next, I'm gonna perform skin trigger tests. There is no tenting. Can I have you flare out your toes for me? All right. No signs of cyanosis. Nails are appropriate size, and capillary refill is under 3 seconds. All right. Next, I'm going to palpate your dorsal pedis pulse. All right. Pulses are symmetrical bilaterally, 2+ in strength, no abnormal rate or rhythm. Next, I'm going to palpate your posterior tibialis pulse. Okay. Pulses are bilaterally symmetrical, no abnormal rate or rhythm. Strength is +2. Next, I'm going to assess your hands. Can I have your hands for me? Thank you. All right. No palpable masses in the fingers. Capillary refill is under 3 seconds. No nails are appropriate size and shape. No signs of cyanosis, and no signs of tenting upon skin trigger. All right. Next, I'm going to palpate your radial pulse. All right. Pulses are symmetrically bilateral, +2 in strength, no abnormal rate or rhythms. Okay. Thank you. Okay. Next, I'm going to inspect your head and your neck area. So your head is placed appropriately, size and shape on the body. Neck is midline, erect. Trachea is midline. Can I have you swallow for me? All right. Swallowing was intact, no deviation when swallowing. Lymph nodes are non-palpable, which means no sign of infection. They're not hardening or they're not swollen. Your thyroid is not palpable either, which means there's no goiter present. So next I'm going to perform infection control and palpate your scalp. Upon palpation of the scalp, there are no masses or visible lesions. Hair texture is appropriate, hair color is appropriate, and there are no signs of critters. All right, now I'm just going to perform infection control. Okay, can I have you do range of motion of the neck? So I'm going to have you bend forward, bend backwards, to the right, to the left. Okay, do you have any pain?
No.
Alright, next I'm going to test your spinal accessory nerve. So I'm going to push down and you push up your shoulders. Alright, spinal accessory nerve is intact. Next I'm going to assess your TMJ. So can I have you open your mouth? No signs of crepitus. Do you have any pain?
No.
Nope. Okay. Alright, next I'm going to palpate ears. So upon inspection of the ears are symmetrical in shape and size, placed appropriately on the face. Upon palpation, no palpable masses were present in the ears. Next, I'm going to take my penknife and assess for drainage. No drainage present. And no drainage present. Okay. Next, I'm going to perform the whisper test. So repeat the word after I whisper it into your ear.
Dog.
Cat. Okay. Patient passed the whisper test appropriately. Next, so skin on the face is pink, dry, and warm to touch. Next, I'm going to assess your eyes. So upon inspection of the eyes, they're placed symmetrically in size and shape. Eyelashes and eyebrows are appropriate just placement on the face, their appropriate hair quality. There's no edema of the upper eyelids. Conjunctiva of both eyes are pink and no drainage is present. Sclera is white, which means there's no signs of jaundice. And your corneas are round, irises are blue and round, pupils are 4 millimeters in diameter. Next, I'm going to perform some eye assessment to test cranial nerves and your accommodation and refractiveness to light. So first, I'm going to perform the 6 cardinal phases. So follow the tip of my pen. Patient performed the cardinal test appropriately, and next I'm going to test your peripheral vision. Alright, let me know when you see the tips of my fingers.
Yeah.
Alright, patient passed the peripheral vision test appropriately. Next I'm going to test your pupils' refractiveness to light. So I'm just going to shine a light in your eye. Alright. Alright, pupils reacted constrictively and consensually when the light was shined in them. Next, I'm bilaterally. It's okay. Next, I'm going to perform the accommodation test. So follow the tip of the pen. Perfect. Okay, pupils reacted constrictive and consensually bilaterally. Alright. Next, I'm going to assess your nose. So your nose is appropriate shape and size on your face. Do you have any difficulty smelling?
No.
Okay. Next, I'm going to have you place one finger over one nostril and breathe in. All right. Next, I'm going to have you place another finger over the nostril and breathe in. All right. Patient was clear upon inhalation. Next, I'm going to assess for drainage. No drainage present and no signs of a deviated septum. Okay. Next, I'm going to assess your mouth. So, can I have you open your mouth, please, and stick out your tongue, say, ah. All right. Patient's uvula is midline, tonsils were intact. Mucosal membranes are pink and moist, which indicates hydration. Lips are pink and moist, no signs of cyanosis on the inside or the outside. Mouth was placed appropriately, size and shape. Teeth, there were no presence of plaque on the teeth, and there was no odor. Do you have any problems with taste?
Nope.
Nope. Okay. All right, so next I'm going to assess your lung sounds. Well, first I forgot to do strengthening of your lower extremities, so let me do that first. Can I have you press down? Thank you. And now can I have you push up? Thank you. Okay. Can I have you push up? Thank you. And can I have you press down? Okay. Strengthening of the lower extremities was 5 out of 5. Okay. Next I'm going to assess your lung sounds. Okay. So can I have you stand up and I'll assess your lung expansion first? Thank you. Okay. Lung expansion. Take a deep breath. Perfect. All right. Lungs inflated symmetrically bilaterally. There's no barreling of the chest, and you have no difficulty breathing. Can I have you sit down? Thank you. Okay. Turn to the side. Now I'm going to assess your lung sounds posteriorly first. Okay. Can I have you take a deep breath? Alright. And can I have you take a deep breath? Another breath. Alright. And another breath. Alright. And one more breath. Oops. One more. Oh, hold on. One more breath. breath. Alright, thank you. Alright, now I'm going to check your lungs anteriorly. And I have you take a breath. Alright. And I have you take another breath. Thank you. One more breath. And can I have you take another breath? And one more breath. Alright. Lungs were clear both posteriorly and anteriorly. There were no signs of wheezing, bronchi, or crackles on either side. Alright, next I'm going to assess your cardiac sounds. So first I'm going to palpate your precordium. Alright, upon palpation of precordium, there are no flutters, no signs of heaving, and no difficulty breathing. Okay, next I'm going to auscultate your heart sounds. Okay. So next I'm going to auscultate Erb's point, tricuspid, and mitral. Okay, and next I'm going to auscultate using the bell. So first I'll do your pulmonic. Next I'll do your aortic. Next I'll do Erb's point. I'll do your tricuspid and your mitral. Okay. Upon auscultation, there was no signs of whooshing, no signs of brutes. Strength was +2. And your S1 and your S2 sounds were clear, so that means your tricuspid and your mitral valves are working appropriately. Next, I'm going to I have to palpate your carotid. I forgot. Okay. So first I'm going to listen on this side. Sorry, my hands are cold. Okay. Thank you. Okay. Upon palpation of your carotid artery, there were no abnormal rates or rhythm, and strength was +2. Bilateral. Next, I'm going to auscultate your carotid. I use the bell. And I use the bell. Alright. Carotid artery was symmetrical and sound bilaterally, +2 strength. There are no whooshing or brutes sound present upon auscultation. Alright, next I'm going to assess your bowel sounds. Can I have you twist over for me? Okay. So I'm just going to pull up your shirt. Thank you. Okay. First I'm going to auscultate. I'm just going to auscultate in each quadrant. Okay. Upon auscultation of vowel sounds, there was no hypo or hyperactivity, and gurgles were appropriate. Next, I'm going to auscultate your vascular sounds. Use the bell. Okay. Vascular sounds were clear upon auscultation, and there was no sign of aortic aneurysm present. Okay, can I have you turn around for me now? Oh, hold on. I gotta palpate. Let me just palpate. Let me know if you feel any pain upon palpation. No pain?
Nope.
Nope. Okay. All right. Upon palpation, there were no palpable masses. Upon palpation, and the patient reported no pain. Okay. Now I'll have you turn around. And do you remember the 3 words I told you at the beginning?
Tree, sun, dog.
All right. Perfect. So patient's short-term memory was intact, and she was able to recall the 3 words appropriately. So that's it. Do you have any questions?
Nope.
All right. Thank you.